Good morning. It's August 21st, and this is your daily brief in science. Here's everything you need to know. Eli Lilly has revealed groundbreaking results from a 3-year study showing that tirzepatide, found in Mounjaro and Zepbound, can significantly reduce the risk of developing type 2 diabetes in adults with prediabetes and obesity by an impressive 94%. This study involved 1,032 pre-diabetic participants and demonstrated that those treated with tirzepatide lost an average of 22.9% of their body weight, starkly contrasting with just 2.1% weight loss in the placebo group. Dr. Matthew Anson highlighted that the substantial weight loss associated with tirzepatide may be pivotal in lowering the risk of type 2 diabetes and related cardiovascular complications. The findings, published in eClinical Medicine, utilized anonymized electronic medical records from a global database, showcasing the drug's potential effectiveness. Participants experienced weight loss that was dose-dependent, with the highest 15 mg dose yielding the most significant results. However, a follow-up period indicated that those who stopped treatment began to regain weight and faced an increased risk of progressing to type 2 diabetes, although the overall risk reduction remained considerable. The high costs of GLP-1 drugs, often exceeding $1,000 per month, raise concerns regarding insurance coverage, especially for patients without diagnosed health issues. Common side effects included mild to moderate gastrointestinal issues, such as diarrhea and nausea, which are typical for this class of medications. Given that obesity is a primary risk factor for type 2 diabetes, losing at least 15% of body weight can greatly improve metabolic health and reduce cardiovascular risks. Dr. Jeff Emick from Eli Lilly emphasized the importance of sustained weight loss and clinical benefits associated with long-term tirzepatide therapy for individuals struggling with obesity and prediabetes. The study also underscores the significance of combination therapies to effectively bridge the treatment gap between pharmacotherapies and bariatric surgeries for obesity and type 2 diabetes. With obesity affecting millions globally, these findings highlight the urgent need for effective treatments to combat this epidemic and its associated health risks. A recent study published in JAMA Network Open has raised concerns regarding the potential link between semaglutide, marketed as Ozempic and Wegovy, and suicidal thoughts. This research utilized data from the World Health Organization's Adverse Drug Reaction Database to explore this association. The study revealed that users of semaglutide reported suicidal thoughts at a rate higher than those taking other medications, with a reporting odds ratio of 1.45. This association was notably stronger among patients who were also on antidepressants, where the reporting odds ratio jumped to 4.45. However, when patients on antidepressants were excluded, the connection between semaglutide and increased suicidal ideation was no longer present, indicating a possible interaction effect. Despite these findings, the overall rate of suicidal behaviors, such as attempts or self-injury, was found to be lower in patients taking semaglutide compared to those on other drugs. Novo Nordisk, the manufacturer of semaglutide, acknowledged the study's findings but highlighted its limitations, particularly the inability to account for external factors like patients' medical histories. Researchers emphasized that while the study indicates a correlation, it does not establish causality, and further investigation is necessary to clarify the risks associated with semaglutide. Experts suggest that the findings might reflect either a specific side effect of semaglutide or the psychological impacts of weight loss, rather than a direct effect of the drug itself. Healthcare providers are urged to closely monitor patients with prior mental health issues while on semaglutide, and to evaluate their psychiatric history prior to treatment. Both the FDA and the European Medicines Agency are currently reviewing the potential link between GLP-1 drugs like semaglutide and suicidal ideation, although no conclusive evidence of causation has been established. Concerns have been raised regarding the significant weight loss associated with semaglutide, as such life changes can have emotional consequences. Given the study's findings, researchers stress the urgent need for further investigation into the risks associated with semaglutide, particularly in real-world clinical settings. Halophytes, or salt-tolerant plants, are gaining attention as viable solutions for agriculture in saline environments. As salinization affects approximately 11 million square kilometers of land, it poses a significant threat to global food security. Human activities, such as excessive irrigation and chemical fertilizer use, are major contributors to this pressing issue. Additionally, climate change is worsening salinity problems through rising sea levels and extended droughts, further impacting productive agricultural regions. Salinity has detrimental effects on plant growth, causing osmotic stress, ionic toxicity, and hormonal imbalances that hinder nutrient uptake. High-yield crops, including wheat, rice, and corn, are particularly vulnerable to these conditions, which jeopardizes food production. However, the potential of halophytes and saline agriculture to rehabilitate salt-affected lands is being explored, drawing attention to the need for addressing research gaps and promoting sustainable practices. Integrating sustainable methods in saline agriculture is essential to combat food insecurity and environmental degradation. Innovative strategies are required to reclaim saline-affected lands, especially as the global population is projected to reach 10 billion in the next 50 years. While challenges persist, such as the need for field studies to confirm laboratory results, advancements in genetic engineering, engineered nanoparticles, and mycorrhizal fungi are showing promise in enhancing salinity tolerance and plant resilience. Moreover, organic amendments have demonstrated effectiveness in reducing soil salinity concentrations and can improve plant growth by up to 84% under salinity stress. These developments underscore the importance of continued research and innovation in addressing the challenges posed by salinity in agriculture. Recent research has unveiled a promising avenue for advanced treatments for diabetes and hormone disorders, centered around a toxin known as consommatin, derived from the venom of cone snails. This toxin has demonstrated the ability to regulate blood sugar and hormone levels by interacting specifically with a single protein in human cells, allowing for targeted effects without affecting surrounding molecules. In comparative studies, consommatin has shown to be more chemically stable and long-lasting than somatostatin, which enhances its therapeutic potential. These significant findings were published in the journal Nature Communications on August 20, 2024. Drawing attention to the evolutionary adaptations of venomous animals that have honed targeted biochemical strategies to disrupt prey physiology. The research emphasizes how cone snails have evolved effective chemical solutions for drug design over millions of years, often surpassing human advancements in medicinal chemistry. Helena Safavi, the senior author of the study, highlighted that the precision of these venomous toxins makes them particularly valuable for treating various diseases. The study indicates that examining venoms from lethal animals can yield critical insights for disease treatment due to their evolved ability to target specific physiological processes. The long-lasting effects of consommatin are attributed to its unique amino acid structure, which resists breakdown, suggesting potential for sustained therapeutic benefits. Overall, the research suggests that consommatin could lead to improved treatments for diabetes and hormone disorders, potentially offering therapies with fewer side effects compared to current hormone-regulating drugs. Researchers at the Helmholtz Center for Infection Research have made significant strides in vaccine development, introducing a novel vector vaccine that utilizes murine cytomegalovirus, or MCMV, to deliver genetic information for the coronavirus spike protein. This innovative approach employs a non-replicating MCMV vector, which is deemed safe for human use, thereby enhancing the safety profile of the vaccine while leveraging the strong immunogenicity typically seen in natural infections. Initially reported in 2022 by Professor Luca Cicinsan and his team, the MCMV-based vaccine has demonstrated promising results in terms of immunogenicity and protection against COVID-19. Research findings indicate that this vaccine can sustain a stable concentration of antibodies for at least 6 months following a single dose, suggesting the potential for even longer-lasting protection. The sustained immunity is believed to be linked to the virus's ability to reside in specific niches within the host, which helps to continuously stimulate the immune system. While established COVID-19 vaccines offer strong initial protection, their efficacy tends to diminish rapidly, often necessitating booster shots that may contribute to vaccine hesitancy. In contrast, the mcmv-based vaccine not only increases circulating antibodies but also activates CD8 plus T cells, which play a pivotal role in identifying and eliminating infected cells. Notably, the vaccine generates antibodies against both the original SARS-CoV-2 spike protein and its variants, including Omicron, indicating a potentially enhanced immune response to viral mutations. The immune response provoked by the mcmv vaccine encompasses specific antibodies and CD8 plus T cells, contributing to long-lasting immunity post-vaccination. Moreover, the mcmv vector's capacity for gene insertion opens avenues for developing combination vaccines that could target multiple diseases, such as COVID-19 and influenza. Recent collaborative studies have shown that this vaccine elicits durable immune responses and antiviral protection in mouse models. The findings of this research have been published in the journal Frontiers in Immunology, highlighting the mcmv-based vaccine's potential as a long-term solution against COVID-19. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.